Welcome Gateway College. My name is Rhonda Roper. I'm the Vice President of Clinical Services at BrightView in Kentucky, and I look forward to talking with you today about substance use disorder, understanding some of the signs and symptoms, looking at some of the treatment options that are available, and then talking about the services that we provide here at BrightView. So let's talk about how addiction starts. And addiction starts really based on two components. There's the reward tolerance process and then the compulsive piece of addiction. And so with the reward and tolerance process, essentially by using substances or engaging in behaviors repeatedly, the brain is flooded with dopamine. And so over time, it takes more and more of that behavior or that substance to get the same effect. And a condition called tolerance develops. And so that explains, with addiction, why an individual would need to take more and more of the substance to get the same effects. The second component of compulsion really revolves around the fact that now that it's taking more and more of that substance to get the same effect, then that same process occurs with our thought processes. We still need to spend more time looking for the substance, more time recovering from the substance, and that compulsive piece really occurs there. And that essentially can lead to relapse and continued use as well. So let's talk about what leads to addiction. There are several components. One primary would be genetics. And so if you have had a person in your family that has a history of addiction, there's a 40 to 60% likelihood of that occurring. Environmental factors are also very common. Experiencing what we call adverse childhood experiences. Those are things such as trauma, loss of a parent, something out of the ordinary in your childhood, a parent losing a parent using substances, or any of those traumatic events. Additional, causes can be centered around parental drug use, as well as a lack of support, a lack of peer support, or even exposure to substance use from peers. Some of the early warning signs of addiction, primarily for alcoholism, a common sign is essentially being able to drink a larger amount compared to others. So, for instance, it may be that you drink a higher amount, but you still get a lower amount of intoxication. So you can drink more than your peers. Some of the signs of addiction or of drug or alcohol abuse could be irritability, changes in mood, changes in behavior, changes in appearance. A person's hygiene, may have decreased. They may look more disheveled than usual. They may be having issues with school. Their grades may be failing. Their attendance to courses may be declining. They're missing classes. They're missing assignments. So those are just some of the things that could be, common and some things to look for as far as that goes. As far as the signs and symptoms of substance use disorder, they're a little different depending on what substances that you're referring to. And so we'll start with alcohol. With alcohol, drinking more and more over a longer period of time than you plan to. An example I like to give here is it may be that you start out, just drinking on the weekends, and then you find yourself drinking at different periods during the day. Or it may be that you're drinking to get through the day, or you're stopping off to have alcohol, or sometimes in college students we've seen, they may even conceal, alcohol in a water cup in class or something of that nature. For opioids, some of the signs and symptoms would be sedation, appearing drowsy, pupils being very small, shallow breathing, itching or scratching can be common, nausea and vomiting. If use was occurring, intravenously with a needle, you may also see track marks on the arms or legs. With stimulants, you may see that a person is not sleeping. They're staying up for long periods of time. They're very awake. Their appetite is reduced. They're feeling euphoric or just out of the norm for a typical day as far as having different emotions. They're sort of on a high all the time. They may also have an increased heart rate, and then elevated body temperature is also common. Stimulant use can also have an impact on the breathing, causing it to really increase as well. And then in terms of stimulants, one of the things that can really be noticed is just that pacing or that fast behavior. With benzodiazepines, one of the common things that you'll see there is difficulty walking or a wobbly gait, slurred speech, blurred vision. They may appear confused, dizzy, or drowsy. So since benzodiazepines, really are meant to calm us, that all makes sense, right, to see those things occur. Alcohol itself is a depressant or a downer, and so it is the most commonly used substance in the United States. Certainly, we've seen alcohol use continue to increase during the pandemic that we've currently been experiencing. And then with alcohol use, we also notice that it can have some long-term and severe consequences. Difficulty with liver, and then a condition called wet brain may occur. Essentially, that's impacting someone's memory and abilities in that regard. For stimulants, those are known as uppers, and stimulants, as we discussed a few moments ago, they cause an increase in energy, difficulty concentrating, very awake or very alert. Some examples of stimulants would be methamphetamine, Adipex, some of the weight loss drugs, cocaine, and then some common ones, Adderall and Ritalin would fall into that stimulant category as well. As far as opioids and opiates, opioids are typically the things we refer to as Percocet, morphine, pain pills, if you will, and then opiates would be heroin, fentanyl, and then morphine as far as that goes. So let's look at some of the data that's out there about just addiction and the impact it's having on our communities. Chances are, if we're not experiencing that ourselves, we know someone, in our family, in our community, our peers, or even co-workers that are. So let's look at some of those specifics. In terms of the 2020 National Survey on Drug Use and Health, 50% of people aged 12 and older, or 138.5 million people, used alcohol in the past month. So that certainly is another increase compared to the year prior. In 2020, 14.9% of people 12 or older were classified as needing substance use treatment in the past year. So that's 41.1 million people. So that really hits home there. If we're not experiencing these conditions ourselves, we certainly know that individuals in our community, our peers, or even families are. And so certainly nice to be aware of this and just, again, brings credibility to just the fact that we need to, be focusing on treatment for these conditions just the same as any other health conditions. Finally, people aged 12 or older in 2020, 3.4% or 9.5 million misused opioids in the past year. So that is certainly another increase. 9.3 million people misused prescription pain relievers and 902,000 used heroin. So let's look now at some of the symptoms of alcohol withdrawal. One of the things that may lead someone into seeking treatment are the withdrawal symptoms of alcohol. And so let's look at some of those. First and foremost, withdrawal from alcohol typically kicks in about 36 hours, give or take a few hours there, but it typically is described as being uncomfortable and can certainly be scary for individuals, as most of the time they may not realize what's happening with that condition. So some of the symptoms there would be tremors, feeling anxious, difficulty sleeping, insomnia, and certainly nausea and vomiting are very common as well. Seizures may occur within 1 to 2 days. Again, another thing that typically could lead someone into an emergency room. Again, maybe not knowing what's happening or not connecting that to their alcohol use. And usually that's treated with benzodiazepines in the hospital. A condition called hallucinosis can occur within about 1 to 2 days, and when you stop drinking, what can happen there is, even though you are oriented, you know who you are, you know where you are, you can still be experiencing some hallucinations. Usually they're visual, but sometimes they may be tactile, meaning you feel like something is crawling on you, or you feel like something is touching you. Or auditory, where you may be hearing something as far as a hallucination there. A condition called delirium tremens is also common with alcohol use. That usually happens about 1 to 4 days after the withdrawal starts. Again, this is a really scary part of the withdrawal process with alcohol. And is usually characterized by, again, some hallucinations that we just talked about. Disoriented, not really knowing where you are, and then feeling agitated and certainly feeling, sick or ill. And there's a 5% mortality risk with delirium tremens. So again, a condition that, may warrant someone going into an emergency room and seeking treatment that way. So alcohol symptoms can really be managed with medication-assisted treatment, withdrawal especially. And so there are some other options as far as detoxification. What we just looked at with alcohol use disorder, sometimes will lead an individual into a detox facility. Detox is certainly not forever though, and it's not long-term. And so finding supportive care, and then having care to help with monitoring symptoms on an ongoing basis is very important. Medications that are utilized in medication-assisted treatment include naltrexone, Vivitrol, which is a long-acting naltrexone, Camprol, gabapentin, and benzodiazepines are usually used there. So the good news there is that there are options out there and medications to help with those symptoms that have certainly proven to be effective. One of the most essential pieces to treatment for alcohol use disorder or any substance use disorder is seeking care around, the biopsychosocial model of treatment. So meeting with a clinician for an assessment to determine, what has led to the alcohol use. How is that alcohol or substance use affecting your life? And by biopsychosocial factors, really what we're meaning there is looking at, we talked on a little earlier about that family component that may be happening with substance use, looking at those stressors that are occurring in life, and then looking at, those other demands and things that, certainly can impact the substance use as well. During the assessment, the clinician will get a detailed overview of those things, looking at, a family history of substance use, looking at your strengths to be able to identify, ways to help those, work with the condition. They may help with looking at stressors around finances, things that are happening in the academic world or in college or school, with your job. And then also looking at things around, our mental health. It may be that there are some life changes that are happening, some adjustment issues, some symptoms of depression or anxiety, which are far too common. The continuum of treatment for substance use disorder really can vary to certain levels, starting first and foremost with outpatient treatment and then going all the way up to inpatient treatment. So typically outpatient would be the lowest level of care where a lot of people start treatment. Intensive outpatient is more intensive. Essentially, folks in IOP or intensive outpatient would be coming in several times per week, whereas someone on an outpatient level, usually just coming in once a week or every other week, maybe monthly, just depending on what their needs looked like. And then there are also residential options, and then those inpatient or detox options that we talked about as well. So for BrightView Health, we do offer outpatient and intensive outpatient programs in all of our locations. And as we've talked about the different options that are there today, most importantly, what we know is that the speed to getting in treatment is life-saving. And so being able to walk in and get an assessment, get the care that you need, at the time that you need it is really crucial in doing that. At BrightView, our philosophy of care is to provide comprehensive addiction treatment. We certainly ensure that we're providing treatment from a best practice model with clinically researched modalities and techniques that have been proven to be effective with our patients, and then also following those best practices that are evidence-based from other organizations and providers. One of the key components of our program is to coordinate with community partners. What we know is that care for any individual really involves a lot of important players in that process, and so collaborating with other treatment providers, whether it be medical doctors, other specialty services that someone is receiving, just that work in the community is so crucial with what we do. As I said a few moments ago, being able to walk in for services when you need them is crucial and life-saving. And with that being said, we do offer a 24/7 patient access center, so patients are able to call anytime and get in for an appointment. We do accept walk-ins, meaning that no appointment is required. We accept those until 3 p.m. every day, Monday through Friday, and certainly see a lot of those in all of our locations daily. And then we also have online scheduling, so again, lots of options there for easy access. Again, getting into care when you're ready and when you need to is so crucial and life-saving, so we want to make sure to offer all those options. I talked a moment ago just about best practices, evidence-based strategies that we're using, and here again, another example of that would just be looking at the Surgeon General's report. And so that Surgeon General report really showed us that essentially long-term use of medications for substance use disorder really reduces not only substance use, but it reduces risk of relapse, it's life-saving, it reduces the risk of infectious disease, reduces any criminal behavior that could potentially occur, and then also just helps individuals with returning to a healthy, functional life, which is the ultimate goal, of course. Types of medication-assisted treatment would include, of course, buprenorphine, sometimes known as Suboxone or Subutex. 16 studies have shown that there is strong evidence for positive impact of buprenorphine on treatment retention and illicit opioid use. With naltrexone or Vivitrol, it's usually recommended for patients that are a bit more stabilized in their recovery process, usually not offered right at the start of the treatment process, but certainly available. And this has really been shown to decrease the risk of continued use or relapse. As far as clinical best practices, I've referred to those a few times today. Just another look at those. As far as our first key component there would be our psychological practices. And so we certainly know that we've talked about at the beginning, substance use, not only occurs from that physical sensation of using, but also that compulsion, that compulsive behavior associated with using. And so that psychological piece is so crucial into the care and treatment of individuals with a substance use disorder or any type of addiction. And so we make a recommendation for every patient or individual that we treat to receive those psychosocial interventions. So again, completing that assessment, partnering up with that therapist and doing that, and then we offer the individual group counseling as a support as well, and really getting to know each person's individual needs and being able to offer treatment, as to what they're able to do and willing to do and what's best for them. Again, the goal there, is returning life to as high a functioning, level as possible. So that certainly is crucial. Looking at some of the statistics, it's always good to look at some of those just to see, if what we're doing is working. And luckily, we have some positive data there to share with you. And so I'll start first in saying that 70% of our patients show a decrease in illicit substance use within the first 90 days. And so that really hits home in terms of showing again, I brought up earlier that getting into care, is life-saving, and being able to get in when you're ready. And so there again, being able to see that 70% of individuals decrease use within 90 days is such a great example of that. We also see a decrease in about a third of individuals using emergency rooms for care. I mentioned going to the emergency room a few times earlier for those withdrawal symptoms, which is far too common. And so what we find for patients that we're treating is that those ER visits decline. And so in 3 months, they've decreased by 50% after 1 year. So again, another a great example of just how effective the services can be. BrightView patients also report about a 50% increase in engagement with just primary medical care and medical treatment. What we know is when individuals are using substances, it's pretty common to just see, the focus on their care and personal health to sort of decline. And so being able to see that increase, in 50% over a 90-day period is again another great example. After 90 days, we've also seen a 50% decrease in alcohol consumption on average. And so cutting drinking in half, is another great example there. So as far as our services at BrightView, we have a few options for you as far as ways that you're able to seek services or refer someone that you may know that may be needing treatment, or most importantly, they may just have some questions. You may not even know, if you do need services, but being able to, reach out and ask and check on that, of course, is crucial, and certainly goes with what we talked about earlier, with having care available when you're ready is so important. So even if it's just to ask the questions to, hey, is this even a service that's for me? Again, very important there. So we have a few options for you. I mentioned, of course, we do take walk-ins, so you can walk into any center Monday through Friday until 3 o'clock. You can also go online to our website, brightviewhealth.com, and you're able to make appointments there, make adjustments to schedules, and also just get some really great information on the program, what a typical day will look like. A little more detail on the services is also available there. And then lastly, we also have a hotline, or 1-833-510-4357, and that's available 24/7. That's that patient call center that I mentioned earlier, that again, you can call any day of the week to get information on the program or to set up an appointment. So I hope this has been a good overview for you today of just substance use disorders, addiction, how it certainly can impact our communities. It can impact our folks in our families, our peers, and we want to definitely just get that information out, as we know it is impacting, and we hope this information has been helpful for you today, and just learning more about this concept, and then also getting information on how to refer someone that you may know, or seeking services as needed. Thank you.